I've been delighted to chair the conference today on NHS health checks. They are so important. Prevention is a vital part of healthcare now. There are more than 5 million people who've got undiagnosed high blood pressure. There's more than 1 million people who've got undiagnosed type 2 diabetes. We need to find those people. We need to treat them before they have dire health consequences as a result of their illnesses.
So the health check programme is the most important, well, it is the single most important prevention intervention that we can make. It's the first in the world at scale, about saying if you pay attention to a range of things, make small differences, you can change the whole course of your health and your life. For example, hypertension, heightened blood pressure, it accounts for almost half of all strokes and almost as many heart attacks. And yet half of people, when they have a stroke or a heart attack, this comes as a complete surprise. If they'd known what they might have been able to do to prevent that in advance, then that stroke may well not have happened, that heart attack might not have happened. And that's what the health check is all about. It's helping you know early about what you can do to avoid something like this happening to you later in life.
I think I'm very clear that when local government takes on a new responsibility, it takes it very seriously and it aims to do it really well. And I think with health checks, we've demonstrated that commitment. And I think what's happening now is local councils are looking at the core health check and thinking this is an amazing opportunity to start a conversation with people about their health, but how can we build on it so that it really tackles the very specific needs of a local area? So I think over time, the core health check will thrive, but it will also be delivered slightly differently in different places.
Well, I think the health check program is a pretty amazing program because it actually engages members of the public between 40 and 75 years in a conversation about their health and provides them with the opportunity to be tested for a range of conditions that, if undetected, could lead to a number of long-term complications, including heart disease, kidney disease, a high risk of stroke and dementia. And it's this conversation, it's this engagement with adults, which I think is so important for us as we think about improving the health and well-being of everyone in the country. We have to all be far more mindful about our health, and we have to take control of our health. And I think the health check program provides one opportunity to do that.
So the NHS Health Check programme provides us a tremendous opportunity in tackling those major risk factors for premature death and disability. It brings together the relevant NICE guidance, whether that's clinical or the lifestyle health and wellbeing guidance. And we know already that over 8 million people have been offered a check and over 3 million people have received a check. And we've now got evaluation findings that are showing that the checks are being taken up by those most disadvantaged communities, and it's tackling and identifying those risk factors earlier. So 1 in every 27 people who get a health check go onto the hypertension register, and 1 in 110 people go onto the diabetes register. But now we need to do more to improve the quality and the consistency of the check.